Today, our video is regarding a medicine called Primolut-N, which is used in multiple conditions, such as to delay the periods, menstrual problems, including painful, irregular and heavy bleeding, premenstrual syndrome, endometriosis, and many more conditions which we will discuss in the video, along with how to use and take this medicine and its common side effects. But remember to always consult the doctor before its use. Primolut-N contains norethisterone, which is a man-made version of the natural female sex hormone progesterone. Now let's see how to take Primolut-N in different conditions. For delaying the periods, it should be taken 3 days prior to the expected timing of the period. Take 1 tablet 2 or 3 times daily, which can be used to maximum of 10 to 14 days. Your period will then resume within 2 to 3 days after the stopping the Primolut-N. For heavy menstrual bleeding and irregular periods, Primolut-N tablet is advised to patients having heavy periods or prolonged periods. The usual dose prescribed is 1 tablet, taken 3 times a day for 10 days. The bleeding will stop usually within 48 hours of taking it. However, consult your doctor if the bleeding continues. Similarly, for irregular periods, take 1 tablet 2 to 3 times a day for 10 days. Your periods will resume within 3 days after stopping the medication. Your body may correct itself after 3 to 4 cycles, and your period cycle may resume as before. Primolut-N is also used in endometriosis. Endometriosis is a health condition in which tissues around the lining of the womb begin to grow in other parts of the body, which causes pain. Primolut-N works by preventing the lining of your womb and any endometriosis tissue from growing too fast. This will help to relieve the symptoms you may have. Treatment in this case can be continued for at least 4-6 months, which your doctor will suggest. In premenstrual syndrome, which is mood swings, tender breasts, food cravings, fatigue, irritability and depression, usually 1 tablet daily is recommended. Now let's see how to use this medicine. Do not chew the tablet, take it as a whole. Use the medicine at same time of the day. For example, if you are taking in morning at 10 a.m., then take in the evening at 10 p.m. also. And repeat the same cycle. The most common side effects of this medicine include headaches, nausea, abdominal pain, vaginal spotting, dizziness, and breast tenderness. If you have any question or suggestion, just drop below, we will answer that.